friends, this is Shrividya. Welcome to my channel on cardiology. Today we'll be talking about this heart valve replacement surgery. So, generally it's nothing to get intimidated, but again, talking about heart, it's your day-to-day activities and your lifestyle. What you eat, how you are. Whether you go for an exercise or walk, that determines the healthy heart. So while you are talking about a heart valve replacement surgery, what is that? That is nothing but it is a procedure to replace a damaged or diseased heart valve with either a mechanical or a biological valve. So how does it is usually performed when the valve is severely malfunctioning and cannot be repaired, like there are no scope of repairing it. That is when the surgeons decide on replacing the damaged heart valve. So this the surgery is basically done to restore proper blood flow through the heart and improve the overall cardiac function. So in many times you might have heard this valvular heart disease. Conditions like we were talking about before, like aortic stenosis, that is narrowing of the aortic valve, or aortic regurgitation, that is the backflow, leakage of the aortic valve. So these kind of things, when it reaches a point in time, like when it is too severe and there is no scope of bringing it onto the normal to normalcy, then surgeons decide on doing a heart surgery, heart valve replacement surgery. So that is when the valve is completely damaged, either by disease, it can be infection, not necessarily. Suppose you are going, so even for some sightseeing or somewhere like traveling, even say the restroom is not so good, you are traveling in between, like you are using some open space, or the restrooms are not really clean, little bit of infection can also cause this. It's not necessarily a major part. Even there are so many bacteria, viruses in the atmosphere. You have to be very careful and in maintaining the hygiene, in the personal hygiene. It can be congenital defects that require the replacement of the heart valves. So if a valve repair isn't possible or doesn't fully restore the function of the heart, replacement is necessary. So first the surgeons will assess the valve, whether that is the very last option. Replacement, valve replacement is a very last option for heart valve replacement surgery. But generally we will try to assess whether it can be, anything can be done without replacing the valve. Can we bring it to normalcy, either by medications or but if everything fails, then we are left with no choice but the valve replacement surgery. So when you are talking about mechanical valves that we use for heart valve replacement, it's made up of durable materials like carbon and metal, and these valves offer longevity, but they require lifelong blood thinning medications to maintain the valve. And another type of valve we will be talking is the biological valve, so which is derived from the animal tissue, animal tissue grafts, or even you can sometimes even human tissue. These valves, they don't require lifelong anticoagulation, but they'll be needing replacement after few years, depending on the how well they are maintained. So there are various surgical procedures when we are talking about heart valve replacement surgery. So there is a open heart surgery, which involves a large incision in the heart. So initially you stop the heart using a heart lung machine to maintain the circulation. It's a big complex procedure. And then the other one is like a minimally invasive surgery, where we use like smaller incisions and specialized instruments, so potentially leading to faster recovery with no big major scars. Then the other one is transcatheter aortic valve replacement, TAVR we say. It is a less invasive procedure where a new valve is inserted via a catheter through the femoral artery in the groin area. So like I said, every surgery, post surgery, it needs like a lot of maintenance, and it involves, every surgery, small or big, involves risks, and post surgical patients ought to be really cared about. And you take any surgery, heart valve replacement also carries risk such as infection, bleeding, blood clots, stroke. So, and the recovery varies from individual to individual depending on the surgical approach and whether it is minimally invasive procedures. Actually, minimally invasive procedures generally lead to, kind of faster recovery times. Then you have patients, typically they spend several days in the hospital, may require like ongoing monitoring and rehabilitation. This all depends again on the type of surgery done on the patient and how serious it is and how much the patient body can take. So when you are talking about the aortic valve replacement surgery, it is a major operation, and occasionally the complications can be fatal. Occasionally. Overall, the risk of dying as a result of this procedure is estimated to be 2%. With the medical line advanced, with all the advancement we have as of today. But this risk is far lower than the risk associated with living severe aortic disease untreated. You should never, if you have any kind of heart ailments, whether it is a simple chest pain or a pain radiating on your left shoulder, or you have a foot edema, even a simple headache can be related to your heart, a cough can be related to your heart, a head injury can be related to your heart. So, cyanosis is also a sign of your heart not functioning properly. So, many might be wondering, how do they repair these valves? So, how do you make the valve stronger is basically annuloplasty, it's called. So, basically what you do is clipping parts of the valve, the leaflets, together to stop it from leaking from edge to edge. And there are many other types too. Surgery itself is a very complex procedure, nothing to get intimidated when we talk about surgery, people, they get intimidated. Nothing to get heart valve replacement surgery, nothing to get intimidated about it nowadays. Everything is being done very well. So your heart valves help control the direction of your blood flow. If one or more of your heart valve is not working properly, it can put extra strain onto your heart. And if this is regularly happening, you may need surgery to repair your heart valve. And heart valve repair surgery is different. Heart valve repair surgery is entirely different from heart valve replacement surgery. So, your heart valve is repaired, not replaced in the heart valve repair surgery. And heart valve replacement surgery, the valve is replaced either by the mechanical or biological valve. So, heart valve repair is more common if someone has got a leaky heart valve where the blood leaks backward when your heart beats. It might be your mitral or aortic valve. And with the heart valve repair or replacement, it improves your quality of life, giving you more energy for everyday task, reduces how hard your heart needs to work, reduces the risk of getting a heart failure, improves the circulation, blood circulation, Like I said, surgery, anything small or big, involves risk with the procedure, you know, so you have to take extra care about it. With this, with the time constraint, I'm going to end this video right here. Please stay tuned to it to know more about the heart valve replacement surgeries and heart ailments. So please subscribe to my channel if you like it. Thank you and God bless.